sensory. So almost all motor is 10. The only exception is stylo laryngeus muscle, which is 9.
So basically 10. If you forgot 9, not the end of the world. Basically 10 is moving our throat. Sensory is more complicated. Nasopharynx is 5, so when you felt that weird sensation during COVID testing, that was 5. Typically gag reflex triggers 9, that's oral pharynx, and then actually 10 is the larynx. So everything in the larynx is 10 actually. So like you could have rarely you could have a gag reflex triggered by something irritating laryngopharynx. In that case, gag reflex would be 10 in, 10 out. But typically it's something's irritating the back of your throat. So that's 9 in, 10 out. Gag reflex. Okay. Next thing I want to do is briefly talk about blood supply to the neck. So at C4, common carotid divides into an internal carotid, external. And the branches I want you guys to find are superior thyroid artery. This is the PowerPoint. That's what we have. Lingual, going up to the tongue, facial, branch going into the infratemporal fossa called maxillary. And occipital. You can palpate it because it goes behind the mastoid process. There's a few other ones, but these are the ones. Actually, you're not going to have to find this either. This, you should be able to see. Oh, before I forget, Wednesday's going to be long, so typical hours, 1:30 and 4:30. And then I'll send an announcement. Monday, I'm not going to be here, but I am going to hold class, but I'm going to do it on Zoom. So it's going to remind you of the pandemic. In other words, it's not going to be, it's not going to be a recording. I mean, it will be recorded, but I'm going to do it live, right? So you could attend. Does that make sense? Okay. I will send you a link. And that means you don't have to show up here Monday, okay? I have to help my parents out, so I'm not gonna be around Monday. Just so I don't forget, next Monday, lecture, not in here, gonna be live via Zoom. Cool? So this is what I just conceptualized with that little box. This is what I just conceptualized with that little box. So I'm not going to say it again. Okay? Just the motor and sensory innervation to the pharynx. And we don't have this view, but you will see these circular constrictor muscles of the pharynx on the bisected head. Right. Vagus, traveling down the neck in the carotid sheath, right? Gives off many branches, including a pharyngeal branch, which I'm not going to ask you to find, but it does give off a pharyngeal branch. Because like I said, almost with one muscle exception, all the muscles of the pharynx are innervated by 10. Okay. We do have the laryngeal branches if you wanted to see them. Not holding you. I don't know, was that on the ID list? Were the external and internal branches of superior laryngeal nerve on the ID list? Okay. If you wanted to see those, I could show them I just did blood supply. So few little tipperoonies. The first branch is typically superior thyroid, and just follow it down to the thyroid gland. That's pretty easy to do. Facial goes like this. It goes up across your mandible, in between your nose and your eye, and that's pretty easy to find. Okay. Lingual could be trickier, but if you can find facial, lingual's often near facial beginning. Maxillary, you're gonna have to go to a body where we've chipped away the cheekbone to do an infratemporal fossa dissection, and you'll see a maxillary artery there. Okay, we have that on multiple cadavers. You don't need to find these. So these are all branches of external carotid in the neck. Internal carotid is not doing anything to the neck. Oh yeah, one other one I want to find. Sorry, I forgot to put it. The terminal branch goes right up here in front of your ear. It's actually clinically important. Oftentimes it can spasm in older people and trigger temporal headaches. But the terminal branch is called superficial temporal artery. Okay, so you can see that right here. We have that on every cadaver. Goes right up here like this. There's a nerve that travels with it. That's why you get headaches, right? with spasms, inflammation. Really painful, actually. It's a condition you don't want to get when you're older. So one last time, let me do it with a different color. So we're thinking about the fact that common carotid branches have about C4 in the neck, and the internal carotid doesn't do anything in the neck. It's just going to the brain for blood. But the external carotid supplies blood outside the skull. Now I want you to be able to find some of these branches. For example, first branch, superior thyroid. There we go. Second and third branch, lingual and facial. Facial goes like this, up, right between your nose and your eye. Okay, so you go right up like that. Okay, and it's kind of down to the mandible. It kind of corkscrews for a bit. It has a really characteristic spiraling that it does. We got an occipital artery heading back towards the back of your skull. We got a major artery going into the infratemporal fossa. It's called maxillary. You don't need to know transverse facial. And then the terminal branch is called superficial temporal, which is running right in front of your ear. Okay. Talked about gag reflex already. So if you're looking behind the pharynx, so you're peering in that retropharyngeal space at the cervical vertebra, you're going to see longus coli and longus capitis. Here's longus coli and here's capitis. Coli, capitis. Capitis makes its way up to the skull. Coli doesn't. They both flex at the neck. Remember, we have the greatest degree of movement in the vertebral column in the neck, thanks to the facet joints. And I'm not asking you about these. I wouldn't worry about these. Minor importance. Okay, so another way to think about it is like looking at this cartoon. If we're standing, looking at these muscles, I'm standing in the retropharyngeal space, the pharynx would be right here. scalenes, we're going to think about a lot more when we get into the brachial plexus. They laterally flex at the neck. They also are attaching at the top of the ribs. They can be accessory respiratory muscles like sternocleidomastoid. Okay. So scalenes attaching to rib 1 and 2, and laterally flex the neck, accessory muscles of inspiration. And between, I'm doing it now, but we'll do it in more detail later, future lectures. In between anterior and middle, brachial plexus. Okay. That's a case where you could have nerve impingement happening. Anything that's like congesting that space, or overactivity of the scalenes for some reason. Maybe. Okay. So here's anterior scalene. Here's middle scalene. In between those is where brachial plexus is going to pop out. That's all happening in the posterior triangle. If you get down to where longus colli caput and a cadaver, that's a great place to see the sympathetic chain. Let me show that to you in black. It's running right on the vertebra, right on those muscles. And in case you're not aware of it, there's a chain of ganglia. A ganglia is a collection of neurons in the peripheral nervous system. There's a chain of sympathetic ganglia on the right side and on the left side of our vertebral column, running from the neck to the pelvis. We're going to see them really well when we go into the thoracic cavity, if you remove the lungs. But you can actually see it in the neck if you know how to look. And this is the system conveying sympathetic information to a lot of the body that's more complicated than that. And I'm going to ask you to see if you can identify the topmost ganglion in this chain. It's called the superior cervical ganglion. It's right below the mandible. Here it is. And it's pretty big. It's like, I don't know, 4 rice grains in a line, maybe. It's pretty big. And the reason this is important is like a second order sympathetic neurons from this ganglion go to the head to do anything sympathetic in the head, like raise your eyebrows, dilate your pupils, sweat. That is all sympathetic nervous system to the head, and all of that's coming from the superior cervical ganglion. So pretty important ganglion. You can see these things right on longus colli, longus capitis. We're going to see that on some cadavers. So here's posterior triangle, right? Sternocleidomastoid, clavicle, trapezius, and you can see why we emphasize the posterior triangle of all those other triangles that you could learn. We got Erb's point here with cervical plexus here. We got anterior and middle scalene with brachial plexus popping out in between. Actually, subclavian arteries actually going between anterior and middle scalene. You see it right here, subclavian artery. So you could actually have a compression syndrome where the scalenes are sandwiching subclavian artery, and that's a pretty bad situation to be in. That's the artery supplying blood to the upper limb. So, you know, just imagine he's put in another rib here, a cervical rib, that could add problems. Oh, this is a cool relationship that we can look for. Right on top of anterior scalene is where you can see phrenic nerve. Right on top of anterior scalene. Classic relationship. Right, the nerve to your diaphragm. C3 to C5 keeps your diaphragm alive. Okay, so that's kind of posterior triangle stuff. So if you were to congest the outlet of the neck by maybe adding a cervical rib, I don't know, something like that, you can make it more likely that some of these things in the posterior triangle get compressed. Maybe it's the brachial plexus. Maybe it's subclavian artery, okay? So adding a cervical rib is often what could cause thoracic outlet syndrome, but it could be other things. Anything that's kind of reducing space in the neck. Just a little bit more info on attachments for longus coleus capitis. I want you to know in particular. And scalens. Longus coleus, longus capitis, and scalens. You know, the other ones. Oh yeah, we're doing okay. Okay, so it's kind of neck. This is a lot. We just don't have enough lab days in this course. You know, so like this is really packed lecture and lab, sorry. But it's, I know, hopefully a lot of you find this pretty interesting. This is our one time to look at a human head and neck and stuff like that. So we kind of have like 4, 5, 6 things to do. Neck, bisected head, blood supply, TMJ joint, infratemporal fossils. It's a lot. So if you look here, you can see that facial artery coming up and it's about to go between the nose and the eye. If you look in front of the ear, heading up to the temporal region of the skull, that's superficial temporal artery. Do not need to know any of the minor branches of it, just anything up here you could call superficial temporal. Here's occipital behind the ear. Okay, so some of the blood vessels I talked about. We can't see lingual from this view, and we can't see maxillary. If you wanted to see maxillary, you have to remove all of this tissue here. Another thing we can see in this view is one of the large salivary glands of the body, the parotid gland sitting in front of the ear, and you can see cranial nerve 7 popping out through it, which is pretty cool. And we have this on multiple bodies. And 7, among other things, is going to muscles of facial expression. So 7 is going to send a branch down here to platysma. You want to smile, raise your eyebrows, close your eyes. All that is muscles of facial expression. All that is 7. I bet some of you here know someone who had, anyone here know someone who had Bell's palsy temporarily? No one? Usually it's someone who's. Bell's palsy is paralysis of half the face caused by irritation to 7. Often it's like post-viral, so like Lyme disease or something. You know, your immune system's attacking Lyme disease and you get Bell's palsy. Okay. So 7 is coming out between the mastoid process and the styloid process. And it goes through the parotid gland and then it goes to all these muscles of facial expressions. It goes to all these muscles of facial expression. I don't want you to memorize all these different branches. Anyways. And can anyone move your ears? Who can do it? Let me see. Hey, yeah. So you have more developed auricularis muscles than most of us are kind of regressed. And that's branches 7 too, okay? Go into those muscles. Now, if you're an elephant, which none of you are, or a rhino, they have really well developed. Like I was working in Nepal for a year, and I did this like, as a little trip, I did this cool little safari. Nepal is a great place for safari, super cheap, awesome animals. And we got to see these rhinos. There was a mother and a baby rhino in their little water hole, which was super cool. And you don't want to piss them off, dangerous animal. But they apparently, I learned, have poor eyesight. But the mother knew, they knew we were there from sound, but also, I still remember this, the mother's ear was turning around like the periscope on a submarine. It was so cool to see that. So some animals have incredible regulation of the auricularis muscles and their cranial nerve 7 system. Most of us don't. This is pretty non-functional in most of us. And these are the branches of 7 for most of us that are functional. So anyways, we'll look for 7, okay? Easy to find on our bodies in the lab. And these are the muscles that 7 is hitting. And you don't have to identify all these muscles, but like some of them are cool. Like some of them are circular sphincter muscles. Like when you close your eyes, orbicularis oculi. Okay. Smile, zygomaticus, and other muscles. Raise your eyebrows, frontalis. Frontalis. All that's 7. Okay, and another interesting thing about these muscles of facial expression is they often have an attachment that's not on bone, it's in the superficial fascia of the skin, which is why we can do the incredible range of facial movements. Like if you think about the broad movements we get with big muscles like biceps, it's kind of just brutish. It's pretty basic. Flexion, supination, do you know what I mean? Muscles of facial expression, it's all kinds of expressions we can do. And that's partly because these muscles aren't attaching completely to bone. They're partly attaching to superficial fascia, so pretty cool, okay? Kind of cool too, a little tangent, I'm just thinking about this. You got, now, like now it's probably like, we're probably 10 years out. They're, maybe not quite 10 years, they're literally doing face transplants on people now. Is that unbelievable? Like taking a face from a cadaver, putting it on a massive burn victim's face or someone who's had a horrible war injury, kind of amazing. And not only are they getting this off muscles of facial expressions to get reinnervated, they get 7 to get reinnervated, so cool. And I was just reading about another case a few weeks ago. Okay. So that's, again, really, you could say this is kind of out of your terrain, but like this is our one time for head and neck, so just showing you a few things. So maybe, I don't know, try and see like orbicularis oculi, it's cool to see, oris, and we'll see zygomaticus on our cadavers. That's a muscle that aids in smiling and things like that. Risorius helps with smiling too. Okay, anyways, we'll see some of these. Okay, this is the last part. And I don't know, if I don't get quite to the end, I have a Zoom up, and you can go to that. But I'm gonna get further than I did last time I did this. So if I don't get to the last 5 slides, it's okay, you can check that out. So it's a little bit complicated to see all the muscles of mastication. What you gotta do is you gotta get into what's called the infratemporal fossa region, which, if you can imagine, is the region deep to your cheekbone. Like that bone there is a bridge. There's a space under it. In fact, I tell my dissectors to take a probe and run it under the cheekbone like this first. And then what we do is we saw off the cheekbone, okay? Pull it off. Then we cut off the head of the mandible and we cut off the mandible here. Take it out. And now you are in this circular space, which is called the infratemporal fossa. 2 of the 4 muscles of mastication are found there. Okay, bad joke. I don't know, like maybe people don't talk about this anymore. That's why most people don't get this. But just want to warn you, like you don't want to use your muscles of mastication too much because you might go blind. Okay. Think about it. Anyways, I don't know if your mother or father ever taught you, like, okay, anyways, sorry. I'll let you think about it. So, we're gonna have to cut all this stuff away. What is he talking about? Mom never talked about mastication. Did she talk about something else that sounds like that? Okay, anyways. Okay, so, sorry, I digress. Here we removed the cheekbone, the mandible, and we're in the infratemporal fossa. And that's where we're going to see the pterygoid muscles. Now, unfortunately, to see the nerves, which are really cool to see in the infratemporal fossa, usually destroy the pterygoids. So what you're going to see is shredded pterygoids. Okay, they're not beautiful. Sorry, they're going to be shredded, but you'll see them. And actually, the lateral pterygoid, you're going to be able to, if you want, pull out the head of the mandible. So it's kind of cool. You can think about its function. You once again, just tying back to some things we talked about today. I know I've thrown a ton at you. Mastoid process, and this hasn't built on anything else. It's like, this is a lot. Mastoid process, styloid process. So right between there is where cranial nerve 7 comes out, right? 7. Between the mastoid process and styloid process. Right? If we look at this bone in red, so really it's a beautiful bone in the skull. You can't really appreciate the beauty of its three-dimensional aspect unless you take it out of the skull. Kind of looks like a bat with wings and it's got legs. This is called the sphenoid bone. And it's pertinent to today because its legs are called pterygoid processes. Do you see one right here? And those pterygoid processes are attachment sites for the pterygoid muscles that are muscles of mastication. Okay, so it's kind of just giving you a sense of because you're going to look at some cadavers Wednesday where we've done this dissection. It's, by the way, one of the hardest dissections to do. It's really hard to do well, but you're gonna see it and maybe not quite understand how we got there. So we had to remove the cheekbone. We had to remove a lot of the mandible to get here. Okay. Yeah, another thing to think about. So styloid process, mastoid process, external auditory canal. Don't confuse that with eustachian tube. Eustachian tube is the internal auditory canal, right? You can put your finger in the external auditory canal, okay? All right, I got, go on tangents there, interesting clinical tangents, but in the interest of time, stop. Okay, so temporal bone. Okay, we're also going to be thinking about the TMJ, right? The temporal mandibular joint, and the head of the mandible articulates with this little fossa of the temporal bone, the mandibular fossa. Now, here's a bad mandible, bad drawing mandible. On the inner aspect is a little hole, which gets the nerve to your mandibular teeth. It comes in, travels through the mandible. This is called the inferior alveolar nerve. I'll show that to you in a second. I'm mentioning this because that little hole that the inferior alveolar nerve gets into the mandible through is called the mandibular foramen. So we don't want to confuse mandibular foramen of the mandible with mandibular fossa of the temporal bone. Mandibular fossa is for the head of the mandible, for TMJ, right? Mandibular foramen is to allow a nerve to get into the mandible to hit your teeth. That's the nerve that dentists are targeting if they're working on your lower teeth, right? Okay. Here's beauty of the sphenoid bone. If you've ever seen I think they're called an exploded skull. I've been told, I don't know if you could really do this, you could take a skull, you could fill it with rice grains, and then add water. And the rice grains will expand, and it will often push apart bones of the skull. I don't know if that's true or not. These are the pterygoid plates, which are attachment sites for the pterygoid muscles. That's why I have a whole slide just on the sphenoid, if you're wondering. Okay, so the pterygoid plates are attachment sites for pterygoid muscles, which are muscles of mastication, and the pterygoid plates are part of the sphenoid. You can see the wings. You can see why some people think, does it look like a bat or something? Right. Okay, so muscles of mastication. Okay. So the biggest one is temporalis, easy to see. coming off the temporal bone, and it is attaching to this little coronoid process of the mandible. Coronoid means coronation, means crown, crown of the mandible. Okay. And it's really got two actions. I don't, like, be careful here, okay? I could imagine even tagging one or both sets of these fibers on an exam and expect you to be able to differentiate the actions. These fibers towards the front of the face are more vertically oriented with respect to the mandible, so they elevate it. But the posterior fibers are more transversely oriented with respect to the mandible, and they retract. So be careful, temporalis retracts and elevates. Okay, next muscle, easy to see. By the way, we don't have to do any infratemporal fossa dissection here to see these two. The masseter is coming off your cheekbone, and it's going down to this bend here, this angle of the mandible. See it? It's called the masseter. And it's basically vertical. This is basically an elevator of the, if you want to chew food, you probably noticed your jaw goes from side to side. These muscles can help with that too. The pterygoids even more. Okay, but now if you want to see the other two, you now have to do that infratemporal fossa dissection. To do that, like I said, you gotta remove the cheekbone, then you gotta make a slice through the head of the mandible and a slice here, and you have to take this chunk of the mandible off, okay? And then you gotta dig out fat and connective tissue and try and separate out blood vessels and nerves, and if you're lucky, this is what the pterygoids would look like. One set of pterygoids parallel the masseter, and so these are the medial pterygoids. And so their function is like the masseter. They elevate it. So check out like the medial pterygoid attachment site on the inside of the mandible. Let's say we're looking at this mandible, but from the front. So watch me here. Here's the mandible from the front. Okay. And so what I'm saying is, like, on the outside, this is where the masseter attaches. On the inside, this is where a medial pterygoid attaches. They mirror each other. It's like a sandwich. Masseter, medial pterygoid sandwich, mirror image of each other, really like their attachments. Does that sort of make sense? Okay. Okay. Now, lateral pterygoid's really interesting. Here it is. Notice, it's just completely different fiber orientation from the other muscles of mastication. And that's why, of the four muscles of mastication, only the lateral pterygoid can open the jaw. Only the lateral pterygoid can protract the jaw. So lateral pterygoid opens the jaw. Of course, I just taught you, anterior belly of the digastric can open the jaw too. That's not a muscle of mastication. Okay? Lateral pterygoid can open the jaw. It's a protractor. And if you're wondering, like, how is that possible? Look at the orientation. Look at that. Okay. Here's that temporalis again and masseter again. And if you're wondering about the nerve innervations of these puppies, these are all branches of V3. Okay, what's V3? There's 12 cranial nerves. We just learned a lot about the spinal nerves of the lower limb, right? Okay. We're soon going to learn a lot about the spinal nerves of the upper limb, okay? But there's 12 other nerves in the body coming off the spinal cord that are just going to the head and neck. They're called cranial nerves. And the fifth cranial nerve is called the trigeminal nerve. And sometimes we call it the V nerve. And it's got 3 branches. So trigeminal nerve has 3 branches. V1, V2, and V3. We use that word V from the Latin numeral for 5, okay, V. This is the 5th cranial nerve. It is the 3rd branch of the 5th cranial nerve, and only the 3rd branch of the 5th cranial nerve that has motor fibers in it. So the four muscles of mastication, masseter, temporalis, medial pterygoid, lateral pterygoid, they are all innervated by V3. You could be more granular if you wanted, but if you just said V3, I am okay with that. But you could say the nerve to temporalis, the nerve to the masseter, the nerve to lateral pterygoid, or you could just say motor branches at V3 and identify. And on an exam, you get full credit either way. Okay, so retract, elevate, masseter, mostly elevation. Maybe a teeny bit of protrusion and help with side-to-side movement, but really mostly elevation. Okay. Now, if we want to see these pterygoids, we gotta, again, I've said this like 5 times, chip away the cheekbone, remove some of the mandible. Now we're in the infratemporal fossa. And you can see how medial pterygoid fiber orientation parallels masseter. Lateral pterygoid's really like in a, I don't know, category of its own. Okay. Interestingly, the superior head of the lateral pterygoid literally is attaching to the TMJ joint capsule, which is pretty cool, and the TMJ disc, joint disc. The TMJ is one of just a couple joints in the body where there's an articular disc in the synovial cavity, and which is kind of cool. Another one is sternoclavicular joint. There's a few places. All of these, V3. This is V3. This is V3. Okay. This is a really cool view, like kind of looking up at the mandible and forward a little bit. It's a little bit hard to wrap your head around this. You can see this is kind of what I just drew. Here's the mandible, and you can see how the masseter and the medial pterygoid kind of are mirror images of each other, right? See it over here, medial pterygoid, masseter. And just look how completely different orientation the pterygoids have, okay? Which is why they're open jaw. See how lateral pterygoid attaching to the joint capsule and the disc. It's going to help pull, see it? It's going to pull the head of the mandible out of the mandibular fossa. Here's the mandibular fossa of the temporal lobe. Right? Okay. So, kind of went over this already. These muscles can help unilaterally in chewing, where we're kind of moving the jaw side to side. And otherwise, bilaterally, they're doing things like I just talked about. Open the jaw, elevate the jaw, things like that. More detail if you wanted to see. It's all V3. V3, 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 V3. Okay. This is a little cute little cartoon representation of V3, which is really belongs in a neuroscience course. I don't want you to memorize this, but it's just trying to show you there's 3 branches to the trigeminal nerve. There's a cool little finger mnemonic. See what we teach? You can try it. Take 3 fingers. Okay. Put them on your face like this. This is showing you the territory of the trigeminal nerve. V1, sensory to your forehead and actually the top of your nose. V2, sensory to your upper lip and below your eyeball. And V3, sensory to your chin. V1, V2, V3. But V3 has another attribute which the other branches don't have. V3 is carrying motor information to the muscles of mastication. Good. Keep doing that, Jackie. And when we have a party, you want to see this. This is going to be our secret greeting. If you want to, from now on, get into the cadaver lab, you're going to have to do that. Get in. Oh man, I thought I did good.
You're doing great.
Proud of myself. Really proud of myself. Let's just finish trigeminal nerve. 3 slides and done, okay? So, another complicated picture that you do not have to memorize, just showing you again. Look at V1, V2, V3, right? V1 in green, V2 in orange, V3 in yellow. V3 is pertinent to this lecture because it's the nerve supplying muscles of mastication. V1, V2, V3. Now, let me end by doing a picture, and the rest you can get on a Zoomy. I apologize if you're going to have to go to a Zoomy. It's already available, but this is our one and only time to talk about the head and the neck, and there's a lot of info, so deal with it. Sorry. Can I erase some of this, or some of you want to take a photo? So I'm going to end with a little picture of V3 that I often ask you to draw on an exam, so you should be able to get this. I'm going to end with a picture of V3. So V3 is the third branch of trigeminal. How does it get into and it's going into the infratemporal fossa. Now we know how to get into the infratemporal fossa. It's going to go through a hole in the skull called foramen ovale, and then immediately it's going to give off muscular branches to temporalis, masseter, lateral pterygoid, medial pterygoid. Okay, then it's going to give off a branch that's going to the front of the tongue. And so this is the lingual nerve. It's going to give off a branch that enters wow. That's my attempt at that's like I've never seen a worse mandible. But there's a hole on the inside of the mandible, so that's called the mandibular foramen. And this nerve is entering the mandible. Okay. Now it's inside the mandible, and it's giving off dental nerves. And if you got to do a root canal, okay. So this is the inferior alveolar nerve. Right before it goes into the mandible, it gives off a branch that doesn't go into the mandible, and it's going to go to mylohyoid muscle and anterior belly digastric. So nerve to mylohyoid. We're going to see that on the cadaver. See it? Lingual, inferior alveolar, nerve to mylohyoid, muscular nerves, and then there's a branch that goes up in front of the ear called the auriculotemporal nerve, which is traveling with the terminal branch of your external carotid just to end. Remember, the terminal branch of external carotid was superficial temporal artery. Okay. Lingual artery, superior thyroid artery, facial artery, occipital artery, and then we're going to see in the infratemporal fossa region, because the only way you can see these branches of V3 is to do the infratemporal fossa dissection. We're going to see the maxillary artery here. Okay, so the rest of the things on the Zoomy, it's already available. I got further, but yeah, sorry. Okay. Anyone want to go to lab? I'll let you in. Otherwise, see you Wednesday. Okay.